Hey everyone, Dr. Joseph Benny here from Atone Chiropractic, and today is the ear infections webinar. We're going to be talking about ear infections. That is an ear, believe it or not, from my awesome drawing skills. But I'll explain what's going on the marker board here in a minute. But first, you guys might be wondering, why am I talking about ear infections as a chiropractor? I actually got into chiropractic as a child with ear infections. So this is really close to my heart, and why I wanted to become a chiropractor in the first place is because when I was younger, I had a lot of issues with ear infections, among other things, and the chiropractic care that I received was able to help me a lot with the ear infections and all those other things. But really, chiropractic care throughout my entire childhood transformed my health, and that is inevitably what led me to become a chiropractor and go to chiropractic school. And here we are today. I'm helping other kids with ear infections and a lot of other issues so that they can grow up and become healthy adults, just like I was able to do from my chiropractic care. Shout out to Dr. Greg Miller, my chiropractor as a child. But today, ear infections is the topic of discussion. I'm gonna be describing, what's going on, what's really the root cause of a lot of ear infections, and what you can do to help your child with their ear infections, whether they have one ear infection a year, or maybe they've only had one ear infection in their entire life, or maybe they are the more common case that we see a lot is ear infections that happen over and over and over again, where it's a child who has had 6, 7, 8 ear infections in a matter of months. All right, that is what we see a lot. So what's really going on? Why are the ear infections reoccurring over and over and over again? We're going to talk about that, but let's get right into it. We see a lot of kids in our practice with ear infections. Like I said, we're a pediatric and prenatal practice, so we see a lot of families, pregnant women, kids, for a lot of issues. And ear infections, I would say, is one of the most common reasons children come to us, is because of ear infections, and they've heard that chiropractic care can help. They're not really sure why, so I'm going to be explaining to you how that happens and what's going on and how we're able to help. But ear infections are not just common reasons that children go to chiropractors. It's one of the most common reasons children go to any doctor, whether it's a pediatrician or a medical doctor or urgent care. It accounts for 30 million doctor visits or pediatrician visits a year, ear infections. And we know that 80% of children have an ear infection by the time they're 3. So something's going on where a lot of these children are having ear infections, but we don't really know why. We hear a lot that doctors tell parents that the reason their child gets ear infections is because their eustachian tube isn't developed yet, or it's not big enough, or it hasn't gotten to the proper angle yet, and they say that gravity isn't allowing the ear to drain. But we know that gravity doesn't really have a whole lot to do with how the ears drain, how the fluid from the ears drain. It's more movement of our facial muscles and movement of our head and neck. That is what gets the muscles inside of our ear to pump and contract, and that actually milks the fluid out of our ear and out of our sinuses. So I'll explain what's going on and how that mechanism works here in a minute. But first, what are the types of ear infections? We know that there's actually 2 main diagnoses that people receive when they take their child to a doctor. It's either an otitis media, which is an inner ear infection, or there is otitis externa, which is an external ear infection, where it's more on the part you can see when you look inside the ear. All right, and so when you have an ear infection that is more visible on the outside, when you can just look and see redness and pussiness and crustiness on the outside of the ear, and your child has a lot of pain or aches when somebody touches their ear, or if they touch their ear, that is usually an otitis externa. But if you can't see anything and your child still seems like they're protecting their ear, or they're crying, they're just cranky, and you can't see anything going on, but that it seems like they're protecting one side of their face, that might also be an ear infection, only in otitis media, which is going to be in the middle ear where you can't see it. All right, so that would be where a doctor would have to take their scope and look in the ear and see if there's a lot of inflammation and infection inside the ear. All right, but there's also two different types of causes, two different things, infectious things that cause ear infections, and it's either viruses or bacteria. So you can have a viral ear infection or a bacterial ear infection. And we know that viral ear infections are the most common type. They account for about 80% of ear infections. And so a lot of times what I want to address here is that a lot of times when parents will take their child to an ear infection, or take their child to a pediatrician, and they'll find out they have an ear infection, the pediatrician a lot of times will diagnose or prescribe a antibiotic. But unless they test to see whether or not it's a viral ear infection or a bacterial ear infection, they don't really have, you know, the proper information to prescribe that medication, prescribe that antibiotic. It's viral ear infections that are the most common type, but you can't help a viral ear infection with an antibiotic. An antibiotic is only going to help with a bacterial ear infection, which only accounts for about 20% of cases. All right, so you need to make sure if you're getting prescribed an antibiotic, make sure your doctor does a culture to see if it's a virus or a bacteria. That way you can know if it's a bacteria, then yes, antibiotics may be the case, maybe the thing that helps your child. But really, that still doesn't answer why the child is getting the ear infection in the first place. Okay, so we'll talk about that more specifically. But the reason I want to caution you guys about, you know, just receiving the antibiotic prescription, why you want to be diligent in making sure your doctor is doing all the proper tests, is because antibiotics have side effects. And if your child is having multiple ear infections a year, 6, 7, 8, and you're getting, you know, 6, 7, 8 rounds of antibiotics, those are going to impact your child in other ways other than just wiping out the bad bacteria in their ear. It's also going to wipe out the bacteria in their gut, which you need good, healthy bacteria in your gut. But antibiotics doesn't discriminate between good bacteria and bad bacteria. Antibiotics wipe out all the bacteria, and so that's why a lot of times if you have multiple rounds of antibiotics, your gut health starts to decline. Your body isn't able to break down the nutrients that you're eating and the foods that you're eating, so you can't get those foods distributed throughout your body appropriately. And same thing with children. That's why we start to see a lot of children with digestive issues or sensitivities with histories of antibiotics, and it's even related to an increased relation to asthma, increased prevalence of asthma with children who have had a lot of ear infections. Okay, so just do your due diligence and make sure your doctor is testing to see if it's a virus or a bacteria, so that you know whether or not you need an antibiotic or not. Okay, but let's talk about why an ear infection might be happening over and over and over again. Well, let's think for a minute why, you know, any type of infection starts. Is usually because there's a proper environment for that virus or bacteria to settle in and to make that area or that location its home. So whether it's a sinus infection or an ear infection, that is what's going to be, you know, the cause is that's a proper environment for a virus or bacteria to settle in. Okay, and so just like when you go to a lake, if there's really still water, there's a lot of times a lot of bugs and gnats and mosquitoes that those bugs make that still water their home because they like that environment. And same thing for viruses and bacteria. They like nice, warm, dark, wet areas. And so if there is fluid built up in the ears and it's not draining, then that is going to be a perfect environment for a virus or a bacteria to settle in. And that's where we start to see infections, ear infections, sinus infections occur, okay? So why would there be fluid be built up in the ear? Well, let me describe my marker board, my awesome drawing here, and help you guys understand this. So your ear, you guys all know what the external part of your ear looks like. That is what I have drawn here beautifully. But then you have your eustachian tube right inside the ear, and then you have a muscle called your TVP muscle that attaches to the eustachian tube. And your TVP muscle is your tensor veli palatini muscle, and that is a muscle that contracts and relaxes to help milk the fluid out of the eustachian tube. So it contracts and it pulls this eustachian tube and it kind of squeezes it and pumps it so that that fluid can drain out of there back into the throat and out our body. Okay, and so you kind of see how I have my drawing here. There's the eustachian tube where fluid can sometimes settle in, but then the muscle contracts and it pulls the fluid or milks the fluid into the throat, the little mouth here, and then the fluid goes down out our body. All right, so what else do we have going on? We have our brain sitting up here. It looks like a little nut. That's your brain. And then you have a nerve coming off your brain that goes down through this top bone in your neck called your atlas bone. It sits right here, right under your ear. And that nerve goes to that muscle, that TVP muscle. And that nerve is what's controlling that muscle and telling it to contract and relax. All right, so if this area has fluid built up in it, usually it's because this muscle is not contracting and relaxing, okay? So why would that muscle not be contracting and relaxing? Well, what's controlling the muscle? Like I just said, it's the nerve coming from the brain. And so we know that there's only one area that that nerve really travels through that could be causing any sort of problem, and that is that upper neck bone. And so if there is any kind of misalignment or fixation, or that bone is just stuck, that is going to cause irritation of the nerve that's going to that TVP muscle and lead to problems with that muscle contracting and relaxing. And so then the fluid that's inside the eustachian tube just gets built up, and that's where a lot of bugs lots of viruses or bacteria start to make that eustachian tube their home, and infection sets in. All right, so that's the mechanism for how ear infections start. It's not really anything to do with the angle of the eustachian tube or anything like that. But why would that bone in the upper neck, the atlas bone, be stuck or misaligned? Well, there's a number of reasons that can cause that in a child. There's lots of slips and falls and traumas that children experience when they're learning to walk. So any one of those could be the reason that your child has a misalignment in their upper neck or some sort of issue going on in the motion of the joints in their neck. But the number one reason that we see children having this tension or stress or these misalignments in the upper neck is because of the birth process. With all of the pulling and twisting on a child's head and neck during a C-section or forceps delivery or a vacuum extraction, or even a natural labor where the doctor is just simply pulling on the baby's head and neck, that can cause there to be a misalignment, which we call, as chiropractors, we call that a subluxation in the upper neck, okay? And that would cause that nerve to be irritated and lead to ear infections in many cases, and that's what we see. Sometimes it can be related to torticollis in children. They can't turn their head properly, or they can't latch and feed on one side of mom as opposed to the other. There's a number of different things, but specifically with ear infections, that's what we see going on. So as chiropractors, we are able to assess and find which bones in the neck are moving properly and gently restore them with very gentle adjustments. Usually it's very light touch or light input in a child. We don't need to do a full-on adjustment with like a manual adjustment like a lot of times you see with adults. But our office, like I said, we specialize in pediatrics and pregnancy and families, and so we actually are very, very gentle with everybody that we care for in our office. And so that adjustment will restore the proper motion to that joint and allow the nerve to function properly, and allow the signals from the brain to that TVP muscle to get to where they need to go so the fluid can start to drain out and restore proper function to the eustachian tube and the drainage system, and allow the ear infection to heal, okay? So that is the mechanism for how chiropractors are able to help with your child who has an ear infection, or maybe they have multiple ear infections. And just a little bit about my story. Like I said, I was a child who struggled with a lot of ear infections as a kid, and I had numerous rounds of antibiotics. I had 2 sets of tubes put in surgically, and nothing was doing anything to help. The tubes would help a little bit, but then as soon as they fell out, my hearing and my ear infection problems would come back. They would come back, and I eventually got to the point where I was 80% deaf because of all the stuff that was just blocked up in my ear. And so my parents finally got told by somebody to take me to a chiropractor, and after about a month of care, my ear infections were gone and my hearing was back to normal. Everything had drained out, my ear infections healed, and I haven't had an ear infection since. All right, and that was about 22, 23 years ago now. So completely transformed my life, and that's why, big reason why I do what I do now is in helping children and families get their children healthy, and helping you to have your child be healthy as possible so that they can grow up and be as healthy as possible when they get to be older. All right, healthy children grow up to be healthy adults, and sick children grow up to be sick adults is one thing that we always say. But if you have a child that's struggling with ear infections and you think that we might be able to help, we would be happy to get them assessed. In our office, we do some very specific testing and technological objective measurements to see where there might be stress or tension in a child's nervous system or in an adult's nervous system. And it's all very non-invasive, pain-free. A lot of children enjoy doing it. It feels like a little back rub or a back massage. A lot of times to them, they laugh and giggle, but that'll show us exactly where your child has stress or tension, and we can tell you whether or not we're able to help or not at that time. And so for that first visit, when you come in and we do those assessments, normally it's $150. But today, with this webinar, we're partnering with the National Wellness Foundation, and we're actually going to be doing it for only $47. So anybody that watches this webinar and signs up for an appointment in our office to have your child or your entire family, you can all come in for that $47, and we're actually going to donate that $47 to the National Wellness Foundation for pediatric research for chiropractic. All right, so we can help more kids and more families with the care that we provide. So if that sounds like something you'd be interested in, or you have more questions, please give us a call. Our office number is 614-259-8786. Otherwise, you can reach out to us online or on Facebook, and we'd be happy to answer all your questions. Or simply message us on Facebook, and we'll be happy to respond. If you have questions, comment. I'm sure other people have the same questions, and I'd be happy to clarify or answer the questions if I didn't address them in this video. All right, guys, thank you for watching, and have a good night.